This video will discuss the side effects of Tadalafil, also known as Cialis. One of the common questions I get is that, well, I took Viagra and I had some side effects, so I want to switch to Cialis because I don't want those side effects. The bottom line is that every drug on the planet has side effects. It's inevitable. It doesn't mean that you're going to have them all. A person can take a drug and have no side effects. Their best friend can take the same drug and have horrible or life-threatening side effects. The bottom line is that every single drug will have a list of potential side effects, and some are more common than others. You can find that information usually in the package insert that comes along with all your prescriptions in the United States. So some of the common side effects of Cialis include headache, flushing, upset stomach, stuffy nose. Back pain is sort of a peculiar one for Cialis compared to sildenafil or Viagra. Muscle pain, nausea, dizziness, rash, vision tinting or changes, very common with erectile dysfunction medications. There are some worst case scenarios. The one to point out with any ED medication or a lot of the PE medications is priapism. That is defined as a painful, sustained, prolonged erection, usually 4 hours or more. And this is a true medical emergency. As a former emergency medicine physician, I've seen this numerous times in the ED, in the emergency department. Patients come in with a painful erection that needs to be treated, and the treatment is generally fairly straightforward, but on rare occasions it can require surgery, and delay is a problem. So if this falls out into one of the side effects that a person experiences, I encourage that person to seek immediate emergency medical attention. Although embarrassing, possibly, failure to address this will be life-changing, to say the least. Vision loss can and does occur, more common with people who have retinal problems. Hearing loss has been reported, including ringing of the ears. Heart attack and stroke, obviously those are worst case scenarios with ED medications. And the bottom line is, don't lie. If a person has some underlying medical problems, some medications, some supplements, some illicit substances that they use, some medical condition that they don't disclose, it makes it very hard for the prescribing provider to really help gauge the safety and efficacy of a drug. So just be honest, be truthful. And Cialis and Tadalafil, like any medication for ED or PE, it's not for everybody. Those who have severe untreated heart problems, angina, these medications are prescribed with extreme caution or not at all. People who use poppers or rush, this combined with ED medications can be catastrophic and result in death. Nitroglycerin combined with ED medications will cause a profound, impressive, life-threatening, potentially devastating drop in blood pressure. It's very hard to correct. It's one of the first questions we always asked our patients, male patients in the emergency department who had chest pain. Hey, have you used any nitro? Have you used any ED medications, Cialis, sildenafil, Tadalafil? There's a whole list of Me Too ED medications. It's important to rule that out. Those who've got some lung problems, pulmonary hypertension. Again, the bottom line, take-home point is disclose all medical conditions to the prescribing provider. Obviously, I don't want to cover every potential possible side effect. We'd be here for a long time. If you want the nitty-gritty details about every nuance, every possible side effect, even those that are extremely, extremely rare, I encourage you to check out pdr.net, and you can search for Cialis or Tadalafil, and you'll get the full list of every potential known side effect or consequence. Tadalafil or Cialis remains very popular for a number of reasons. One, it removes the timing from the equation. Two, it works not only for sexual reasons, but also for prostate health. And the duration of action, up to 36 hours, again, makes it very convenient for a lot of people. So let me know, as always, if you have questions. And please, please be fully honest and transparent with your prescribing provider. This presentation is just for medical information, and you need to discuss any concerns, any issues, any potential side effects, contraindications, interactions. All that needs to be discussed openly and honestly with the prescribing provider.